Respiratory virus season is well underway, and experts are predicting challenges, especially around influenza. Immunization is considered the best defense, according to doctors and scientists. But for some Albertans, accessing the flu shot for their family has been confusing and time-consuming, adding to concerns that vaccine protection will be low this year. Stephanie Thomas has more.
Jeanette Piddington says it's been cumbersome to get the flu shot for her 4 young children.
This year has been quite complicated. We've never run into the roadblocks that we have. We need to go to 3 different buildings and make appointments through 3 different sources.
Her oldest 2 children will get their shots at the nearby pharmacy. For her toddler, she spent time on 811 and on the booking website and will drive across the city for an appointment booked at a Northeast Community Health Clinic.
We're in a first world country with universal health care. We should be able to book the appointment online, walk in within a week and get your children, your family, yourself vaccinated.
It's tarnished her trust in the province's public health strategy.
This is purposeful. There's no way.
According to experts, this flu season is expected to be a tough one. The dominant strain of influenza, H3N2, has caused serious illness in the United Kingdom and in Australia, areas that are considered early predictors of what's headed our way.
H3N2 is can tend to be a little bit more severe, and more importantly, our vaccines are not quite as good at dealing with that.
A woman in her 60s has died of influenza so far this season. 8 people needed intensive care. Right now, Alberta counts about 10% coverage with influenza doses.
But people who are vaccinated have a lower risk of severe illness, hospitalization, ICU admission, and tragically death. So we do still encourage people, even if there's a mismatch, to take that shot that affords some protection.
This former chief medical officer of health says additional barriers to vaccine rollout for influenza and COVID-19 means more illness will spread and the hospitals may become overwhelmed.
We don't have the capacity to absorb significant amounts of activity from influenza or COVID or both.
The province says its respiratory virus dashboard allows real-time monitoring and adjustments, including the ability to add 130 additional beds in peak months. Stephanie Thomas, CTV News, Calgary.
Now, in addition to vaccination, the province also says the best way to prevent spread is to stay home when showing symptoms, cover your cough or sneeze, wash your hands, and keep surfaces clean.